sepsis and septic shock assessment is the story of the severe sepsis snake, the shocking sepsis snake, and the assessman luring their victims down into their underground lair. The sepsis snake downs a box of microthrombones, which represents the fact that microthrombi begin to form in severe sepsis. This eventually leads to the development of DIC, or disseminated intravascular coagulation, shown by the dice being thrown. This is a condition in which all platelets and coagulation factors are used up and patients are at risk for hemorrhage. Decreased oxygenation saturation, shown by the down arrow percent O2 tank, can occur as a result of severe tachypnea in an attempt to compensate. Acute respiratory distress syndrome, or ARDS, may occur as a result of alveolar damage in the lungs. While sepsis usually presents with high WBCs, sustained sepsis may result in decreased WBCs, as they are used up, shown by the down arrow white MACMAN. As refractory hypotension leads to septic shock, urine output decreases, causing oliguria, shown by the old gopher trying to pee in a urinal. Eventually, high output heart failure occurs, shown by the high output dead heart. This condition is defined as increased cardiac output unable to meet metabolic demands. Lastly, multiple organ failure can occur, commonly referred to as multiple organ dysfunction syndrome, or MODS, and is shown in this picmonic by the multiple dead organs. This is the result of prolonged ischemia, which leads to irreversible damage of organs and subsequently death. So to summarize, severe sepsis and septic shock assessment involves microthrombi formation and eventually the development of disseminated intravascular coagulation, or DIC. Patients have decreased oxygen saturation levels and decreased white blood cells. They develop oliguria and eventually high output heart failure. This may lead to multiple organ failure and eventually death.